Welcome to Global Village Show. Today we have two great guests, Dr. Ken Sauer, the chairperson of the Palliser Triangle Healthy Advisory Council, and Deputy Chairperson, Mr. Martin Shields. Welcome to the Global Village Show.
Thank you.
Thank you, Ahmed.
Dr. Ken, would you please able to give us a little bit background of yourself?
In terms of my personal,
Yeah.
Well, what's happened here, I've been a school superintendent here in Medicine Hat School District for 14 years. I've been a city councilor on the City Council of Medicine Hat for 24 years. I've been a private consultant, and now I'm just a plain volunteer, keeping busy and out of mischief if I can.
Being a chairperson of the council.
Yes, and by the way, Mayor Shields and I were both on the Palliser Health Authority before, and so when this came up, they appointed us along the way. But it's a challenging roller coaster ride that we're on in terms of the Palliser Triangle Health Advisory Council.
And what is the what they do then, the council?
Well, our job is to be a pipeline between the communities in this region, and we take up all of the southeast corner of Alberta. And we're supposed to tell Alberta Health Services some of the major issues that people are finding in their lives, and trying to find answers for people who have concerns. And so the idea is to listen to people, pass it on to our board, and then pass it on to the Alberta Health Services. For a while there, we were quite concerned because when we were passing things up there, Ahmed, what happened is that they weren't answering back. So what the people in the communities were finding out that they didn't know what was going on. So we asked them to get back to us, at least so we could tell the people. And there's nothing worse than passing on information to either Martin or myself and then not hearing anything back, because then they feel that Ken and Martin forgot about it. And so they have issued a policy now that within 14 days they'll get back and tell us, A, whether or not something is being done, B, whether or not it needs more investigation, or thirdly, that they can't handle it at all. So at least we can get back to the people and tell them that their concern is one of those three things.
Wow, that's a very honor. I think that's a very challenging job.
It certainly is. It certainly is.
Okay, Martin, as a deputy chair of the council, what are the challenges you face then between Alberta Health and the community?
Well, good question, and I think the challenge is to have people understand that we actually exist. And I think that's one of the things we've attempted to do, is organizing meetings in the communities. Ken, through his leadership on our board, has made sure that, one, that there are meetings of the board out in the communities, but two, that as a board members in our communities, we have responsibility to organize local meetings. And I think, Ahmed, you're aware of a couple of the meetings that occurred in Brooks, and then there's been ones in Bazzano. And we've had a pretty good turnout from our point of view of people coming out and talking about the issues in our communities. And that then comes back, as we collate that information, comes back to Ken, who has the responsibility, as he mentioned, as the chair, of making sure that information is put together and forwarded on. And he has the opportunity, as he explained, at the different avenues which he as a chair to provide that information. But it depends on us and the communities on this board is to provide input, one, that we hear in our communities, but two, holding public meetings to gather that information so he can document it and supply it to the Alberta Health Services.
I was just checking the website of the council, and it seems that they have divisions within Alberta, Triangle, Palliser, and then you have north of Alberta, and they have several divisions.
Well, when we first got started back about 2.5 years ago, we were just part of the total package across the province, and it made it very, very difficult, by the way, to kind of bring things together. Now they've divided up the province into 5 zones. We're in the south zone, Lethbridge and us. And then there's the Calgary zone, and then the central zone, and then Edmonton zone, and a north zone. So now we have people who are much more responsive to our questions and our issues, and they get back to us much more quickly. And of course, there's no doubt about it that the South has some very unique needs in terms of its communities compared, say, to North, up in Fort McMurray or Slave Lake or wherever, or in Calgary, where it's very urban, or Edmonton. And so we have to balance those kind of issues and remind Alberta Health Services that we're not all the same. And that was probably a weakness, I believe, and I'm going to say this right up front because that's been my opinion, was a weakness to bring everybody together under one. Because it's very easy to centralize buying computers or even doing finances or buying beds and paper. But you can't centralize well, that's maybe, you can't centralize personal health issues because they're very unique to Brooks or very unique to Bassano or Oyen or to Bow Island and or to Medicine Hat. So that probably has caused a lot of concerns over the last number of years and will continue to cause concerns because you just can't fit everybody into one box.
So why do you think they would not change that idea then?
Well, I think originally it started out by having a bit of, and I'm going to use quotation marks, political atmosphere with it, a concern about some of the things that were happening in Calgary Health Authority and the Edmonton. And it seems to me that it would be very difficult then, I'm going to compare this to a ship. You've got a big ship, 5,000 passengers on it, and you're going along. It's very hard to turn it. But what happened here, it seemed that it was done very quickly and probably without the planning that should have gone into it. And now to reverse that again might be more difficult. So I think what happens here is we are quite happy now that we are in the South Zone. And I think the South Zone, both Lethbridge and Medicine Hat regions, and I'm talking about our centers here, we have a lot of common ideas and common things happening, and I think we can make more headway by having those 5 zones than we did before.
So this zone is from Bassano to Medicine Hat, Bow Valley, Brooks, and all that?
Yeah, we start up in Oyen, and go to Bassano, Brooks, Redcliffe, Medicine Hat, Bow Island, and Foremost. It's very close to the old Palliser Health Authority, and maybe it's a little bit more added to it, but generally speaking, the southeast corner of Alberta. And then the Chinook one picks up from that right over to the BC border. Yeah, and so that's the South Zone.
Okay, that's the South Zone. That's, we hope sometime they will come in the middle ground, at least for sometimes middle ground might work better for community as well as Alberta Health Services.
One of the issues that Ken would talk about as far as decision making, that there's different issues in our zone, was the food issue in the sense that the rural sites of Oyen, Brooks, Bow Island were faced with a menu that was designed in Edmonton and food shipped out, so local decision making. And I think that's one of the things that the health councils really raised an issue with Alberta Health Services, and through Ken is bringing that issue to the table. That was a little different than Medicine Hat, but it was very different that the menus just weren't working as being directed from Edmonton, and no local input into the food that was in our health facilities. And so that was an issue a year ago, that a year and a half ago, that we really dealt with strongly. And then in Medicine Hat, they have different issues that they would deal with, but yet as a group, we bring those issues forward. Obstetrics was another one that you remember that we dealt with through this board that we dealt with. I think specialists has been an issue that you've dealt with in Medicine Hat.
Well, absolutely. Coming back to the food issue, though, because we raised a concern, because we were being convinced or persuaded by Alberta Health Services that this was the best thing in the world, what they had. And by raising the issue, by the way, we were out at Bow Island for our meeting back a year ago, or a year and a half, and lo and behold, they had changed because we had asked them to, and we actually ate the food that they were serving in the long-term care, and it was good. So there was some action, and that's good too. But one of the common things across the whole region here, and probably across the province, is finding family physicians or specialists. And it is a problem, by the way, for people in Brooks or Medicine Hat or Bow Island. If they need a specialist, they have to go to Calgary because we are short of those. And that means then that somebody, their caregiver or a family member, has to take time away from their job probably to drive 3 hours to Calgary, wait around, and sometimes have to stay a couple of days and come back again. And that's a problem for anybody across this province, because having it a distance away always means that you're never too sure. And you can't always take the air ambulance or an ambulance. You probably have to drive. And sometimes if you get weather like you have at Brooks today, you would probably have some difficulty, or what we had here on Monday. So
the challenge that Brooks faces kind of new. I'm sure that other places in Alberta also is the shortage of medical doctors, of which we had experienced in the past. How you think those challenges can overcome as Albertans, because that is Albertans' health is very important for all Albertans. How you think that can overcome, and that will avoid in the future not to have a shortage of medical doctors?
Well, I tell you what, right across Alberta, there are, I think every area is looking for them, but Dr. Vanessa McLean, who is the medical director for the South Zone, I've been very pleased, and I think Martin is too, by the fact that she is working every day to try to find physicians. And I think she has found some for Brooks, she's finding some for Medicine Hat, she's even finding specialists. And you have to depend on a person like her, because she's responsible for all the medical needs in this region, or in the South Zone. And if she advertises, or if she tries to find a family physician, say in Saskatchewan, who might transfer over to Alberta, that's one thing. But if somebody from Saskatchewan, say from Leader, Saskatchewan, comes into Alberta, that means that Leader doesn't have one. And the same thing happens because we find that a doctor, the word of mouth is probably the best way. So if someone from South Africa is working in Brooks or in Medicine Hat, and they know some friends who are physicians in South Africa, they can convince them or persuade them to at least apply. But then, of course, we get concerns, or Alberta gets concerns, and so does Canada, if they take too many physicians from South Africa. And we are, by the way, both here in Medicine Hat and Brooks, I know that we do have a few of those, and of course they're friends. They're anxious to come here because the conditions are just a little bit different. But you have to be careful. So it's a balanced act. So advertising, word of mouth, and the work that Dr. McLean is doing, and Vince Danino, by the way, here in Medicine Hat, the two of them, they've got their tentacles, their fingers into a lot of pies, trying to find people that they can persuade to come here and practice here.
The other side of it, and we remember back when the primary care networks were started, back when we were on the Palliser board, and we've been strong supporters of the primary care network, and the nurse practitioner is part of that. And I think you've taken that message to meetings, that the nurse practitioners, because there is a doctor shortage, and stealing, as you say, doctors from somewhere else, but developing the primary care networks and the nurse practitioners is a key part of that. I think it really is a future, what we need for healthcare for our people. So I know that's a message you've worked with.
And in fact, we're working on it right now, Ahmad, and that is the nurse practitioner is a transition between a physician and having someone know their health needs. Now, what happens, the primary care network, as Martin mentions, we have about 90% of our doctors in this southeast corner who actually have a PCN working with them. And this primary care network, a nurse, can look after my blood pressure, for example, or she can look after giving me or Martin advice on diabetes and things like that. So that means that the doctor, if I have an appointment with a PCN nurse, the doctor can look after a more serious situation while they look after me. Now, the nurse practitioner, in fact, on next Tuesday, we have started out the process of working with Alberta Health Services in Zone 5, Athabasca University, and our PCN nurses. There are PCN nurses who would like to become a nurse practitioner, which really is a nurse with a master's degree. And if we can get that, for example, 25% of the residents in Medicine Hat do not have a family physician. And if we could get, say, 5 nurse practitioners here, that means that would take care of a lot of those. So we're working on this, and on Tuesday, we're actually going to be having a conference call with Alberta Health and our primary care network here in Medicine Hat, and the college, and Athabasca University, and Alberta Health in Edmonton and Calgary, to find out if we can do a pilot program to test that test that model. And if we can do that, if we could get 10 people as a model to be working as in Lethbridge area and this area, 5 there and 5 here, that would help a lot of people who have concerns about not having a family doctor.
The other side of that is we've met with our doctors, and they, with that primary care network, they would also like to look at how it could affect the ER in our community, because the doctors in our community, family doctors, they have to do rotations, that's part of the job of being in ER, and then do the regular clinic. So they would like to explore that concept of, we have people in ER that don't need to see a doctor, but they could see the nurse practitioner. And so they would like to see a way of possibly reducing the number of hours they need to spend in ER with a nurse practitioner supporting them and lessening that workload in the evenings and nights for them as as family physicians. So that's another piece that the doctors are talking about and exploring as well.
When I grew up just across the border in Saskatchewan a lot, I was actually, there was a VON, a Victoria Order of Nurses nurse. She handled everything except surgery. And so I think when Martin points out that a lot of people are coming to emergency rooms because they don't have a family physician, and there are things that a nurse practitioner could take care of. In fact, there's a program now running out of the Medicine Hat Regional Hospital that Dr. Danino and a couple of physicians have done. There are many seniors who don't have a family physician. They come to emergency and they're given medication or whatever, but there's no follow-up. So they have set up a clinic next to the hospital where somebody will be there on duty to follow up to see how they're doing on the medication that has been prescribed for them. And so there are different ways to do it, but we have to find out, because there's nothing worse than having young families and or seniors, or even in the middle between the young families and the older people, knowing that there's a doctor or someone to check to. And I must mention that HealthLink 24/7 out of Calgary, and there's one out in the north too. Young families with little children who never get sick before midnight. All of us get sick after midnight, so they can call this number 24/7, and we've been handing out little magnets to put on their fridge. Call there, and there's a registered nurse at the other end who will give advice of how to look after that little person. And if it's really, really serious, then they'll recommend they go to emergency. But there's another thing again. Worry, health is a unique thing for each person or each family. And to have that kind of reassurance that HealthLink is at the other end, and or a nurse practitioner or these family or these physicians here in Medicine Hat taking the seniors to follow up on them, I think that eases a lot of mind, and the comfort it has to be reassuring.
We do have in our house, we have that magnet in our
Oh,
fridge.
you have it?
Oh,
good.
good.
For you. Excellent. That's what we want to see, every family.
Yeah, we do have, and we encourage the new Canadians to have them just in case. In the case of Brooks area, Mayor Martin said, Deputy Chair, we have different also population-wise.
Yes.
We have, that's why we call the city of 100 Hellos, and we call home and Brooks. The challenge is a little bit different from other cities when you're dealing with a lot of immigrant population. Most of them don't have a family doctor, as you know.
Yes.
The doctors who are in Brooks and Count of Newell are 95% from South Africa.
Yes.
Canadians from South Africa. The mental health issue is rising issue that also needs to be tackled. What is your take on the mental health issue when it comes to whether mainstream or immigrant?
Well, that's an excellent question. It's one that's not just been in our area, but it's been arising around the province, saying we have mental issues in the sense of children in schools, adults in the workplace, and as you say, in a different climate that people are coming to, a different society, and the struggles they may have. There's a population out there that it's in the background that mental issues are there, but they're not being dealt with. And so the complicating factors that you're mentioning are occurring. And because Alberta has experienced immigration tremendously around the province from different countries, Brooks is a little microcosm, but I think, as you know, Dr. Sauer, the issues are not just in our area, but they seem to be larger because of the larger percentage of the immigrant population. but it is being recognized provincially that this needs to be dealt with because of the expanse of immigration that's occurring around the province. But in our community, it is exemplified in the sense of, yeah, it's a larger percentage, and an issue that the government has said that they are going to address through Alberta Health Services.
Mental health, there's no doubt about it, and there's a whole spectrum of mental health issues. And what happens, as Martin says, that in the past, some of that has just been slipped over, and that because of other challenges along the way. And I think Alberta Health seems to be addressing and trying to and specialists come in here too, because we need psychiatrists, for example, in Medicine Hat. They look for at least 5 or 6 type of thing, and of course look after the region. But there are other little things like depression and things like that. We have a member on our board who says she goes to the various sessions in the city here, talking to organizations, and they're very, very uptight because they're not getting the kind of counseling or advice that could help them. And whether it's in Brooks or in Bow Island or Medicine Hat or Oyen, if you have some mental problems, and they could be just a simple depression and things like that, it's not a good life, and it affects everything, you and everybody around you. And so that becomes a real priority, that something has to be done about it in a better fashion, so that people can at least realize that there's help there for them.
But also education is part of that, because some of the cultures might see someone with mental issues stigmatized, and person will not come forward if they have a depression, because other person might see you have it. So that also is part of education, that to educate people that is part of life. People can get mental issue. Obesity is also another factor of the problems that facing through Western nations. Alberta is one of it. What your take on obesity and stay healthy issues?
Well, obesity has several definitions, and some reasons for it. Some is genetics. There is just no doubt about it that some have a propensity because of genetics to put on weight, and they can't get rid of it, and it's passed on through to their families. There's the other one, of course, and that is because of our lifestyle in Canada and in Alberta over the last number of years, with television and our little
games,
our games and things like that. And so we sit a lot, and that there's a lot of complaints. And both Martin and I have been in the school systems before, and people always were concerned we didn't have enough time at recess and physical education and things like that. But with the challenges of having both parents working, and the young person coming home and working on their Wi-Fi or whatever they're doing, their hi-fi and all kinds of names, they're bound to be eating junk food while they work, and so they add to the problem. And there's no doubt about it that it's becoming a real concern, and the physician, and here's where the nurse practitioner can come in, because if the nurse practitioner could sit down with a patient or with a client and say, here's what I'd like you to do, change your lifestyle, things like that. And what happens, I'm going to just put 2 things together here. A doctor, because they are paid a fee for service, and with the greatest respect, that means that if you come in, they will spend just a short time with you, because the fee for service means that the patients that they see, they want to make sure that they see as many as they can. Nurse practitioner and geriatricians, by the way, and nobody wants to be a geriatrician because it'll take 10 or 15 minutes to talk to you. And so a nurse practitioner can sit down and talk for 15 minutes about if your lifestyle is going to lead to diabetes, and you've got to watch that because they're so closely connected. And then if something goes wrong with you, if you have something with a leg, for example, and you're obese or you have diabetes, then the complications are terrible. And so again, that's another challenge, another priority. So mental health, obesity, and just a general healthy lifestyle. Eating right, exercising, and just having a positive attitude. And if we could get that, so education is really a big thing, and yet people are not prepared to sit back and say, I want to listen to either Martin or Ken Sauer or to a doctor or somebody tell me that I shouldn't smoke and I shouldn't do this, I shouldn't do this, I shouldn't do this. But there is some headway. We're finding out that there's recommendations and all kinds of advertising say don't eat this, don't do that, and stuff.
But I think also my suggestion is this year being election year.
Yes.
Our premier might call election. I think this is the best time maybe Alberta Health Service will listen the need of Albertans, and your suggestion might be taken serious. That's my personal opinion.
Yeah. Well, we're having an election, by the way, and I'm going to predict on April the 23rd, but that's okay too. But yeah, sometimes the election, when elections are called, that's exactly what happens.
Yeah.
You get the attention of the group and say, maybe we'll change.
Yeah.
But what happens now, and I'm going to be very honest about this, in the last 3 or 4 weeks, and maybe it's tied into an election coming, but there's been a lot of announcements by Alberta Health and Wellness.
Good news.
Not Alberta Health Services. So I don't, that's a question in my mind. Why are all the things coming out of Alberta Health and Wellness? So maybe that's your question is a very good one, your comment. Let's grab them and make sure that they understand that there are health problems and they're not going away and they've got to face them.
That's the need of politicians and the need of Albertans sometimes reconcile during the election time.
Yep.
It's just a magic time that politicians come and listen, which is good. That's the freedom and democracy. My question to Mayor Martin is, you've been this is your second term as a mayor. Would you be thinking of running the third term? And having said that, and live in the area of Brooks that I call home, a lot of people would like to see you running the third term. So what is your opinion on that one?
Well, he's having another election campaign already, and that one's a little farther away. But obviously, I'm very interested in the community and very supportive of the things that are occurring in the community, and be very interested in running for a third term.
And I can give a reassuring comment here that Brooks would be well served by a third term, but with the Mayor Shields. He's a good man all the way around, and I don't say that because he's sitting next to me here. I would say that any place.
Well, for someone, you're a great person and giving back to the community, Dr. Sauer, and I share that view with you. He has done a lot of positive input in our community, and having him the third term to complete third term again, I think will serve the community in a positive way, and probably definitely will achieve a lot of things that is waiting to complete the third term.
Well, he's a caring person, and a city like Brooks needs a caring person as the top person. Yeah.
I appreciate that, but I've got to say about Dr. Sauer in our health region, we probably have the best health advisory board in the province and have had since the beginning, because he has been determined to have the voice heard. He is respected, and he speaks to Alberta Health Services and the politicians in health. And it's the leadership, I think, that he has brought, well, I know that he has brought to the Health Advisory Board, has made a significant difference in this area, because they have listened to him, and he is determined, but is respected for the opinions that he brings to it. So as an advisory board, I would suggest we've had the best in the province.
Well, there you go. Thank you very much for both of you coming to Global Village show today. And it's, as always, great to have you, Mayor Martin Shields, and we hope looking forward, as Dr. Sauer has recommended, the community will be better served under your leadership again the third term.
All right, well, we hope so, yes.
So thank you very much, Mr. Mayor Martin Shields, Deputy Chair of the Triangle Alberta Health, and the Chairperson, Dr. Sauer. Thank you very much for coming.
Well, thank you very much. It's
thank you,
our pleasure, by the way. Our pleasure.
Thank you very much.
Keep up the good work.
Thank you very much, Doctor. This is the end of Global Village show with Dr. Sauer and Martin Shields, Chairperson of the Triangle Health Advisory Council in the southeast of Alberta, and Deputy Chair. Thank you very much, and we hope you will join us next time. This is your host, Ahmed Kassim.